Dr. Rick, my colleague Kirsten, who's working from home, showed me a video of a mom in Arkansas who was dressed head to toe in garbage bags, but had cut a hole in her face area so she could talk. And then next to her was a mom dropping her son off at school and completely spraying him head to toe with Lysol. Your thoughts on both?
Oh gosh, neither one of those are a good idea. The whole point of protective equipment for anyone is to cover the mouth and nose to prevent droplet spread. Uncovering that one area is exactly the opposite of what we want to do.
Right.
And of course, spraying Lysol is potentially toxic and not very effective. So you can use Lysol to clean countertops and surfaces, but not people.
Not students' faces. Okay.
No.
Thank you. I'll let Kirsten know that. All right, on to our next text coming in, 916-321-3310. Is it possible to get a false negative result from a COVID-19 test? Haven't seen that question yet.
So it is possible. We do know that testing is not perfect. That's called the sensitivity of the test. And there are certain circumstances where the test doesn't detect a small amount of virus circulating in the blood. So that is possible. It's rare. It's less than 1% of the time, but it does happen.
Okay, next text coming in for Dr. Rick. When you're recovering from COVID-19, how long are you still contagious? Is it until the symptoms are done with, you feel better, and you're tested clean?
So there are two endpoints that we commonly use. It's 14 days after you were first exposed, or 5 days after the end of symptoms, or a negative test.
Okay, that's good to know. This next one, again, is another one. We're getting a lot of fresh texts in here. Any info on organs of coronavirus victims? Are they transplantable?
So the answer to that is in most cases, no. Organs are screened very, very carefully for transmissible diseases. If there were viral particles in an organ, we definitely would not want to transplant that organ. So the question would be timing of the donation and relative to when the disease had occurred and might be over. The organs are all tested very carefully, so it wouldn't be transplanted.
Next one coming in, we had a doctor on a couple of days ago who was highly suggesting that people get humidifiers, that they be 60%, they be running 24/7, either cool mist or warm mist, that helps with the respiratory system. This next text is about air purifiers. Speak to both, or are they the same?
So they're not the same. Humidification is really simply just adding water to the air. Humidification is known to help with all upper respiratory infections, especially viral infections, by helping the airways stay moist and helping with the body's natural immunity and immune systems. The only reason to be careful about humidification is that the equipment you're using is sterilized, and that you're not dispersing any type of bacteria or viruses into the humidified air.
Okay.
Purifiers, I think there's a lot of controversy about those. They do contain typically filters, and the filters are effective in removing bacteria and some viruses.
Okay.
So they may be effective.
All right, Dr. Rick, we thank you so much for joining us.